Hello, everyone, and welcome to this Heart Learning Collaborative information session. We are coming to you here from the New England Mental Health Technology Transfer Center. Martha, if you could go to the next slide. We are a partnership between the New England MHTTC, the New England PTTC, and the ATTC and SAMHSA Region 1 Administrative Office and HSSA Region 1 Administrative Office. We're so glad that you joined us today. Next slide. Our funding does come from the Substance Abuse and Mental Health Services Administration, but the opinions expressed today are those of the individuals speaking, not SAMHSA itself. At the MHTTC, we use strengths-based and hopeful language. We use recovery-oriented and person-first language. So while you're asking your questions at the end of today's session or using the chat box to ask questions throughout, please make sure to keep all of these things in mind and avoid using judgmental language or making assumptions about others. Today's presentation is being recorded, and about 24 hours after the close of today's event, we'll send you a recording of this event as well as the slideshow and an application to the Heart Learning Collaborative. Your microphones are muted at the moment, and we'll let you unmute those at the very end of today's presentation during the Q&A session. But you can ask questions throughout using the chat. And if you have any questions after this presentation, you can email us at newengland@mhttcnetwork.org, and our personal emails will be on the very last slide. Now I'm going to turn it over to our Director of School Mental Health. Oh, no, I'm not. I'm sorry. I'm turning it over to Taylor Bryan Turner, the Assistant Regional Administrator for SAMHSA Region 1, to introduce the Heart Collective.
Well, good afternoon, everyone. That was a miracle. I was just kicked off of the VPN and the internet, and I made it back on time. So thank you so much. My name is Taylor Bryan Turner. I'm the Assistant Regional Administrator for SAMHSA New England, where we have the privilege of working with Connecticut, Maine, Massachusetts, New Hampshire, Rhode Island, Vermont, and 9 tribal nations. I'd like to thank the New England Mental Health Technology Transfer Center for pulling us all together, and our partners at HSSA, Health Resources Services Administration, for their dedicated partnership and shared vision for this project. Helping to develop this program was a labor of love for me. When I was 15, my family became victims of a mass shooting, and that left an extremely adverse effect in my growing up, in my learning, the way I viewed the world, the trauma that was left on me and my younger siblings. And the word trauma wasn't used, nor was it identified that much. We had to keep going day by day, right? We had to meet our goals, get good grades, go to class, be good daughters. And what I love about Heart, though, is it allows us to identify the trauma that families are facing pre-pandemic and post, and openly confront those challenges head on with a community approach, and families feeling empowered to advocate for themselves. Stress, anxiety, depression, and suicide are affecting youth and our communities, as well as our caregivers and their caregivers. Heart is creating a wraparound service model to address these symptoms of grief, feelings of despair, and we're also looking at social determinants of health through our work. We need to embrace each other, work together, and build healthier relationships for happier people. The Heart Learning Collaborative is on the cutting edge model as a system of care, right? And so we welcome and thank you for being here and for your interest in some really cool work. If you do decide to join us, there will be no shortage of incredible resources constantly coming your way. And for example, MHTTC's Back to School After COVID-19, supporting student and staff mental health toolkits. They help provide guide conversations about trauma-informed approaches, equitable and compassionate lens, providing mental health supports to every member of the school community. That will be us. And behavioral health impacts during and after COVID-19, what to expect and ways to prepare for the return to in-person learning. And so that's just an idea of the type of resources that we will be helping pull together and disseminate. And the use of SAMHSA's Talk They Hear You, just might as well throw that out there. That's a substance use prevention campaign, which released 3 new posters recently and a mobile app. I'll get that in the chat for you. That's for parents and their children. So we look forward to incorporating those resources into the work that we do with you. Thank you so much for your interest in learning more about how to bring heart to your community. And I'll turn it back over to Dana because I'm not sure if Captain Persani will go next.
Yes, thank you so much, Taylor. So the Heart Collective started out as the Heart Committee, and HSSA worked with SAMHSA to kind of have this brainchild. And I'd love to invite Chris to just talk a little bit more about why HSSA believes that this is an important initiative.
Hi, everyone. Thanks, Dana. Thanks for being here with us today. So I'm Chris Persani. I'm the Deputy Regional Administrator for Health Resources Services Administration, the Office of Regional Operations. That name is going to change, by the way. Actually, it's officially changed, and we'll get all that information out to all of our partners soon. But our function remains the same, and I'm going nowhere, so be around for a while. So we're really excited to work with Heart on this project. We think it's really an important issue to be addressing. Trauma in schools is a very important issue. Now, as most of you know, HSSA is traditionally a primary care organization in terms of funding primary care organizations. Most of you are familiar with our federally qualified health centers. Fortunately for me, as a psychologist by training, HSSA has really developed a lot of behavioral health specific activities over the past decade and more, particularly in the area of integrated behavioral health services in our primary care settings. So primary care really has grown significantly in terms of how we define it and the services that are provided. And this also is true for our school-based health centers. And so we're really hoping that some of our federally qualified health centers with school-based initiatives would consider participating in this collaborative. We believe Heart is right down the middle in terms of our strike zone with HSSA and what we aim to do, which is provide primary care and behavioral health services to those who are underserved and in need. And certainly our school-based health centers are serving some of those people now. We think this is a perfect partnership for HSSA. I just want to make it clear that SAMHSA remains the lead for HHS with regard to mental health, behavioral health, substance use services. But HSSA is also very committed to addressing behavioral health as the large umbrella when it comes to addressing it from the primary care setting. And we believe school-based services are part of that primary care umbrella. So thank you all for joining us today. We here at HSSA and in the Office of Regional Operations in Boston really look forward to advancing this initiative and getting some familiar partners involved. Thanks so much.
Thank you so much, Chris. So as I mentioned, SAMHSA and HSSA came to the New England MHTTC, and we immediately invested our partners at the PTTC and the ATTC to help us convene the Heart Committee. And this was a group of leaders in the New England region in the fields of education and behavioral health, as well as family advocacy. And we know that we needed to do this because COVID-19 showed us that those high numbers of youth mental health distress really raised exponentially during the pandemic. And we heard from schools that they didn't have enough staff or funding. However, lots of community healthcare centers already were providing mental health care and had some capacity to help out. While schools and healthcare centers have similar goals, there are several barriers that made effective collaboration difficult. And we discussed those in our committee meetings from November to January. So let's talk about some of the barriers that schools and healthcare centers identified both. There were funding challenges, a lack of knowledge about how to start those collaborations. There wasn't enough staff time to do the coordination. Sometimes there was mission mismatch, difficulty integrating the systems, policies, and cultures of these two different collaborators. There was often lack of support from leadership, lack of an existing relationship between partners. Often schools had physical space challenges for where to provide these services. And there was also a lack of clear roles and responsibilities. We also wanted to think about the considerations from young people who had lived experience of mental health challenges during their time in K-12 schools, pre-K-12 schools. So we had some folks with lived experience join the HEART committee as well, and they helped us understand some things that we might be able to do better when we're talking about school-based mental health. They asked that we increase our focus on social and family environment, not just focusing on what's wrong with the individual, but looking at it from a more global perspective, to help educators understand how to provide mental health support, classroom educators who are directly with students, which the MHTTC's network just released the Classroom Wise training package, a very short 4-module program that helps educate classroom teachers on how to provide that mental health support. The young people in the HEART committee with lived experience also asked us to consider peer support as an evidence-based practice that really helps lower mental health crises for young people. They also asked us to not think about good students as being okay in mental health, but to really investigate every single child's mental health status. They also talked about the trauma that happens when young people enter the mental health system. You can see some of those effects there. And they also discussed the academic and social pressures that contribute to poor mental health and thinking about how we do education in general. And now I'd love to share the opinions of our HEART intern, May Reeves. She is a new 10th grader at Concord Carlisle High School in Massachusetts.
Hello, my name is May Reeves, and I am a 10th grader at Concord Carlisle High School. I am a mental health advocate and social justice activist. When we return in the fall, I believe schools and staff should provide families and students with specific mental health resources to best support their needs during this difficult time. I also believe schools should prioritize social-emotional learning and help everyone within the community to look at mental health through an all-inclusive, compassionate lens. Teaching students and staff to notice the signs of struggling peers can not only help identify those who need support, but build stronger relationships between teachers, students, and families overall. Furthermore, I think it would be beneficial if teachers were provided a training program to help them feel more confident with supporting students emotionally in their classrooms. Staff should extend their passion past academics alone and look to engage students in other ways. Social-emotional learning is important when we return to school in the fall, as it is essential for students to integrate learning academically and interacting with others empathetically. Social-emotional learning can teach students to set new goals for themselves and the community, as well as connect with their own identity, which can be difficult for many to do after so long in isolation. Overall, I believe schools should help students and families return in the fall by prioritizing social connections and peer support.
Sorry, Martha is the director of the School Mental Health Initiative at the New England MHTTC.
I'm also in charge of the slides, which is, I apologize for that. Hi, everyone. I'm Martha Staley. I want to talk to you about how we have conceptualized this HEART work, which is based on our model with 4 quadrants that really put youth and students in the center of everything that we do, but takes a whole child, whole family and community approach to our work. And our first quadrant, our first area of focus in this model is really about prevention. So reducing the causes of childhood trauma and mental health conditions and symptoms. The second is about supporting youth by identifying those children who might be most in need and connecting them with resources, whether it's formal clinical supports or natural resources. And then developing school-wide programming, creating opportunities for kids and staff to connect in the way that May so eloquently described. Our third quadrant is about developing those protective factors, so fostering nurturing adults, building compassionate and equitable environments, and cultivating community. And our fourth quadrant is about building resiliency, increasing the sense of agency for students, increasing the social emotional learning skill set, and empowering and lifting up voices of families and students. So that's the model through which we've conceptualized our work within the HEART Collective. Now, what are the things that Heart Collective is doing to help behavioral health providers and educators throughout the region. Based on the feedback from our group of members, we are developing a Heart website with tip sheets and other resources. We are developing a public health resource campaign. We are meeting with state and regional agencies about policies, legislation, and funding for this kind of work. We are going to create a healthy knowledge online course that will be free and available to everybody. And we are also creating the Heart Learning Collaborative, which is what we're here today to talk to you about and invite you to join us in. I'm going to pass it back over to Dana to tell you a little bit more about that work.
Thanks, Martha. So we're so excited to introduce the Heart Learning Collaborative. This is an opportunity where teams who are already in the early stages of a collaboration around school-based mental health can get some support on overcoming all of those barriers that we identified during the committee phase of this project. So we are going to invite you, if you are a school-based mental health professional or administrator who is interested in or about to start a collaboration, please reach out to us. If you already have an existing collaboration, then you are welcome to fill out our application. And let me tell you a little bit more about what you'll learn in the Heart Learning Collaborative. So we are going to meet from October of this year until May of next year. We'll do monthly knowledge dissemination meetings, trainings, and technical assistance sessions. We're going to front load the knowledge at the beginning of the Learning Collaborative. So in October and November, we'll have 90-minute sessions, and then those will switch to 60-minute sessions as we get into December and the latter half of the collaborative. We're also going to ask that you spend about an hour a month on your own within your change team, completing some assignments that we give and doing some discussions around collaboration at your own school site. If you join the Heart Collective, we're going to give you strategies for how to build and maintain effective collaborations. We'll help you with communication skills to enhance your family and community-based organization partnerships. We'll talk about sustainable funding structures and culturally responsive practices. And we're going to do this by bringing in a variety of subject matter experts from the behavioral health and education fields. We'll provide tip sheets and lots of other articles and online learning materials. And we really think this is a great opportunity because not only are you going to be able to learn from the experts that we have connected to our network, but you'll also join this network of co-learning. We'll be able to learn from you as well. And those lessons that you teach us are going to help us create better products and trainings for the entire mental health field. So we really invite you to become a part of this network. We have a sister learning collaborative called the Childhood Trauma Learning Collaborative, and we do anticipate that there will be a lot of co-learning between the educators in that group of that network as well. So we will invite you to not only learn from others in your own community, but throughout the New England region. So here is our application. You can get your phone out right now and scan that QR code. You'll also get this slideshow tomorrow where you'll be linked to an online version, and you'll also get the fillable PDF version as a part of that email communication. It is due on September 10th, so you have a little over a week, and we are available if you have any questions at all about the application process, or you want someone to help answer questions on whether or not you're filling it out correctly. Just email me. My email is right there. And we also would love for you to help us recruit for our student advisory board. We're looking for middle and high school students who can share their opinions on mental health with us. So again, you could bring out your cell phone and get that QR code, or just look at the slides tomorrow, and please share this widely throughout any schools in New England. We really value family and student voice and think it's really important for us to consider their thoughts and needs. And as you heard from May, our Heart intern, they have some really great ideas. So now we'd love to open it up to any questions that you have. You can use the chat or unmute yourself. Any questions about Heart, about the application process? And if there are no questions, you could use this extra 6 minutes to look over the HEART application. Mika has put a link to the online application form into the chat, and we're always there for us. Please jot down our emails. Martha or Taylor, any final parting words?
To say thank you to everybody who is here and is thinking about joining our work in whatever capacity moves you. We hope that you will join the Heart Collective. And I see that John has a question. So John, do you want to unmute yourself?
Sure. Thank you, Doctor. I did have a quick question. This is being recorded. Where are we going to be able to share this with other members of our community partners and agencies?
Yeah, absolutely. So I will send you an email tomorrow that will have a link to the recording. So you're welcome to share that with anyone. And we will also put a recording link up on our Heart website so that anyone who visits the website can view it as well.
And please do reach out with any questions that you have about your teams, about the work that's involved in this. We want this to be a really collaborative effort. So are there any other questions?
Thank you, everyone. I'll just jump in and say thank you so much. It's nice to see some friendly faces and some new faces. Welcome, Roger. So glad you could stop in and join us today. Hopefully, this has inspired you to reach out to other partnering organizations in your neighborhood that are helping to wrap their arms around youth and children as we go back to school and think of ways to incorporate them into the great work that you're already doing. So thank you so much for your time this afternoon.